Hi, I'm Gordon Francis. I'm an endocrinologist in the Department of Medicine at the University of British Columbia in Vancouver, and I work at St. Paul's Hospital in Providence Healthcare. Over your lifetime, we all can collect cholesterol moving from the bloodstream into the lining of the blood vessels. Atherosclerosis is the gradual development of this thickening and bulging of the wall of the artery into the region of the blood flow. And that is composed of excess cholesterol building up in the wall of the artery. That happens over decades, and it's completely dependent on how high your blood cholesterol is. So if you're someone born with a tendency to have high LDL, what we call familial hypercholesterolemia, you have a lot more of the cholesterol building up, even starting in childhood, than someone with a normal cholesterol level. And that's completely asymptomatic. You don't feel high cholesterol and you don't know that it's building up in your arteries. So the only way to know if you have it is to do a blood test to check your cholesterol level. Other than high cholesterol, other risk factors for heart disease are smoking. When you smoke, it's very damaging to the lining of your blood vessels, and that allows more of the bad cholesterol particles to move in, and also makes it more likely that a blood clot can form on top of a blockage and lead to a heart attack. High blood pressure over a long time also causes thickening of the artery wall and is a big risk factor for heart attacks. And diabetes, for a number of reasons, people with diabetes are at higher risk for heart attack, not just because of high blood sugar, but other changes that happen in the artery wall. We hear about, people who lose their spouse and then within a month have a heart attack themselves. And so we know that stress, when you release stress hormones and adrenaline, there can be damage to the lining of blood vessels, and that can lead to like a clot forming on top of a damaged blood vessel and lead to a heart attack. So when measured with validated questionnaires, psychosocial stress was actually the third leading cause of having a heart attack after high cholesterol and smoking.